Okay, so let's start from ENT. So okay, so we'll start from the structure of the ear. So the ear consists of the outer ear, the middle ear, and the inner ear. The outer ear is the external ear, and ear canal collects the sound. So and the sound and carry it to the middle ear. So sound waves will come here to the middle ear, and from here till here it is the middle ear. And this is the eardrum or tympanic membrane, and the three tiny bones in the middle ear vibrates when hit by the sound energy. So the sound waves will come and hit the tympanic membrane, and this will further convey the sound waves to the incus, stapes, and malleus. Okay, incus, malleus, and stapes. So this is the middle ear. So most of the infection from here, from the nasopharynx, will go upward into the middle ear. Okay. Now this third thing is the semicircular balance canals collect information about head movement and body position. So this information will be given further into the inner ear. So inner ear consists of the cochlea, okay, and this is the cochlea, and these are the three semicircular canals. Now they consist of the very tiny hair cells which convey this information to this nerve, which is called as vestibulocochlear nerve, the eighth cranial nerve. And from here, the mind will perceive the sound. Okay, and the hearing and the balance nerve, it also give you balance information from the cochlea and semicircular canals to the brain. So let's move further here again. So here they have elaborated the bones, malleus, incus, and stapes. So you have to remember the stapes one, okay? Because this will come in otosclerosis. Now let's move further. Now, okay. So let me tell you briefly about the Rinne test, okay? So and Weber test, okay? Now about the Rinne and Weber test, suppose this, look at the A one, okay? So Rinne is positive, normal hearing, bone air conduction is perceived louder than the bone conduction. So normally what happens, so this is a normal image, okay? So the first one is a normal image. When you, okay, so when you put the, okay, so the Rinne test evaluates the hearing loss by comparing the air conduction to the bone conduction. Air conduction occurs through the ear, near the ear, and it involves the ear canal and the eardrum. Bone conduction hearing occurs through vibration picked up the ear by specialized nervous system. Okay. Okay, let's explain now. So in the normal ear, when the tuning fork is hit, so first of all you will hit the tuning fork. Okay, it will start vibration. So first of all you will place it over here behind the ear on the tympanic mastoid process. Okay, on the bone. So the bone conduction will occur, okay, through the mastoid bone into the inner ear. And when you will ask him, you will ask him to tell us or to tell me that whenever you stop hearing through the mastoid bone, you just tell me or notify me. So the patient will tell you that now I have stopped hearing through the mastoid bone, through the bone conduction. Okay. Now the same tuning fork, you won't touch it or you won't disturb it, and you will place it in front of the ear. Now the vibration, okay, which are coming out of it will go directly in the ear into the outer ear. Okay, so this is the ear conduction and this is the bone conduction. Now what will happen is, So air conduction is always double, always double. Air conduction is always greater than bone conduction and double the amount. Okay, actually the doctors measure the time difference. So the time difference is that you will be hearing the tuning fork waves double the amount of duration which are from the bone conduction. Okay, I hope I am making you people understand. So this is called as air conduction is greater than bone conduction. Okay, so normally this is positive. This is called as Rinne test positive. Just remember, Rinne is behind the pinna. So this is a pinna of the ear, and behind the pinna is the Rinne test. Okay, pinna behind the pinna. So air conduction and bone conduction are compared. Now we are comparing both the test. So normally what happens is air conduction is double the amount or double the duration of the bone conduction. Okay. So suppose the bone conduction was 3 seconds. So the air conduction will be 6 seconds. Okay. You will hear the tuning fork which is conveyed through air 6 seconds, double the duration from the bone conduction. Okay. Now, moving forward is the Rinne negative. This one is the Rinne negative. What will happen is that suppose you block the air by any means, okay? So the air vibration cannot pass through the obstruction. The air vibrations or sound waves cannot pass through the outer air. So what will happen? That bone conduction will be perceived as normal. So the bone conduction will be normal, but the air conduction will be blocked by some obstruction, maybe wax or something. Okay, so what will happen? So this patient, I told you the air conduction was double the amount, the duration of bone conduction, but here what will happen? You will not be able to hear through the air conduction. Rather, you will hear better with the bone conduction. Okay, now here what will happen is bone conduction will be greater than the air conduction. So BC, bone conduction will be greater than AC. Okay, so this is a Rinne negative and negative. Okay, this we call it as negative. Okay, why? Because you are having a conducting hearing loss now here. Okay, how? Because your bone conduction is far more greater than air conduction, which is abnormal. Okay, now I hope you people understood. Now moving to the third one. The third one is Rinne positive sensory neural hearing loss. What will happen? Okay, in sensory neural hearing deafness, so normally these are the two conditions. Okay, you check the conductive hearing deafness. This is the first test to be done in the hearing test. Okay, so you struck tuning fork and will place it here and here. If there is a bone conduction is greater than air conduction, either in left ear or right ear, then you will say that ear, suppose it is right, okay, in right ear bone conduction is greater than air conduction, so you will say there is a conductive hearing loss in the right ear. It's so simple. And if you receive the bone conduction which is greater than air conduction in the left ear, so you will say that there is conductive hearing loss in the left ear. Okay, I hope this is understood. Now moving to the third scenario. The third scenario, here it is. Okay, now you can see is the Rinne positive sensory neural hearing loss. So they have assumed that this patient is having sensory neural deafness. Okay, sensory neural deafness. So what will happen? As I told you, the bone conduction will be normal. Okay, the air conduction will be normal. There is no obstruction. But the thing is that you are having some problem with the inner ear, some problem with the sensory neural, some problem with the cochlea. It may be with the semicircular canals, or it may be with the vestibulocochlear nerve. Okay, all these three can cause you sensory neural deafness. So what will happen? If this patient has a sensory neural hearing loss, he will perceive the sound, okay, through bone conduction as well as through air conduction. But the thing is, how you will differentiate it from the normal? Normal is air conduction is double the amount or the duration from the bone conduction. But here because I told you that there will be sensory neural hearing loss. So the patient will have AC greater than bone conduction, but not double the amount. Okay. So here the air conduction will be positive, or Rinne test will be positive, which means it will be perceived as normal, which is air conduction is greater than bone conduction. Okay, in normal setting as well. But the difference here will be that you will not hear as good as the normal air, but there will be a lag between the air conduction and bone conduction. So it will not be the double the duration of the air conduction, so it will be just above the bone conduction. Okay, so it will be a bit delayed. Okay, like suppose
please can you repeat it again?
Yes,
please.
Sure. Yeah, so what happens is, if you are having a sensory neural deafness, okay, if a patient is having sensory neural deafness, okay, and you are basically sensory neural deafness, the test used for it is Weber test. Okay, the test used for it is Weber test, but I am just giving you an extra information. So if you were to perform a Rinne test on a sensory neural deafness, what result will you get? Okay, if you were to perform a Rinne test on a sensory neural hearing deafness or air, so what result can you get? So the result will be same as that of normal, but the difference here will be the normal air duration is air conduction is double the duration of bone conduction. Like if you hear the tuning fork, when you place it on mustard, okay, suppose if you struck the tuning fork and you place it on mustard, so you will hear it for 3 seconds. And when the same tuning fork you place it against the 1 centimeter against the ear canal, okay, so now you will hear the same tuning fork for 3 seconds more, okay, like for 6 seconds. So air conduction will be for 6 seconds. So here you see that air conduction is double the duration of the bone conduction. Okay, this is normal. But when a patient is having sensory neural hearing deafness, okay, so what will happen is that this patient bone conduction will be 3 seconds, but air conduction will be of 4 seconds. Okay, I'm just assuming, I'm just giving you an example for clarification. Can you mute yourself if you don't mind? Okay, so there is voice coming. So if you have any question, you can ask. Okay, so I was telling you that for sensory neural hearing loss in any ear, the proper test to do is Weber test. Okay, but if somebody asks you that you have to perform a Rinne test on sensory neural deafness, what result are you going to get? So then you will answer him that you will have the positive Rinne test positive, which is normal. Okay, which is normal. So on sensory neural hearing loss, the patient Rinne test will be positive, or it will be normal. It won't be negative or abnormal. Okay, so that's why we do Weber test to differentiate it. Okay, otherwise you won't be able to differentiate whether it is sensory neural or conductive. So if anybody asks you that I am having conductive hearing loss, conductive deafness, so the test you are going to perform is Rinne test. Okay, first. But if the patient tells you that I am having sensory neural deafness, or you want to differentiate sensory neural, so then you will perform Weber test. Okay, and so I was just giving you an extra information that if a scenario comes to you of a sensory neural hearing loss, and the patient tells you that you have to perform, okay, you don't have the option of Weber, you have to perform Rinne test. So what results can you get with the sensory neural deafness on the Rinne test? Okay, so that is the bone conduction will be greater than the bone conduction, air conduction, but it will be less than the duration. Okay, it won't be the double the duration of the air conduction along with the bone conduction. I hope you people understood. Now,
okay, thank you.
Okay, so now we will move forward to the Weber test. Okay, now Suppose you did the test, okay, Weber test, okay, and on one side, on right and left, okay. So I will. So what will happen? So here you can see is a, which is this ear? This is a right ear, okay. This is a, yeah, this is a right ear, and this is the left ear, okay. So the problem here was with the right ear, okay. So suppose you are having conductive hearing loss on the right ear, conductive hearing loss on the right ear, okay. Now what will be the result of Weber test if you perform the Weber test, okay. Now Weber test will give you two results, okay. Weber test will give you two results, okay. Suppose if it will lateralize. Lateralize means you will perceive the sound greater, okay, than the another one. So it will lateralize to the sensory neural. It will lateralize to normal ear. It will lateralize to normal ear, or it will lateralize to conductive deafness ear. Now, if the patient is having conductive hearing loss, sorry, this is Rinne test, okay. So suppose the patient is having conductive hearing loss in the right ear, okay. Here you can see in the right ear he is having conductive hearing deafness. So so you will struck the tuning fork on the head or on the vertex, okay, on the vertex. So it will be equidistant from both ear. Now you have to ask the patient there, where is the sound greater, whether the sound is greater in this ear or whether the sound is greater in this ear. If he tells you, if you have already done the Rinne test and the Rinne test result shows you that he is having the conductive deafness in the right ear, how he will show you? Because the bone conductance will be greater than ear conduction, okay. Now the next thing you want to do is you will perform Weber test. Now you ask him that where you perceive the sound greater in amount, so it means lateralization. So where because he is having the conductive hearing loss in the right ear, so his sound will be perceived in greater amount where there is conductive hearing loss, okay. And if the same patient had sensory neural hearing deafness, if the same patient has sensory neural hearing deafness on the right side, okay, he will perceive sound greater on the normal ear. Okay. I think you people are confused. Okay, let's see this test, okay. Now I will explain this test. So when you do the Weber test, okay, now this is normal, okay. Now this is normal. If the patient tells you that both the sounds are normal in amount, if he tells you that both are normal, okay, both are perceived equal, so both will be equal, okay. There will be no lateralization. You can see lateralization means that there will be no perceiving of sound in greater in one ear than the other, okay. So there will be no lateralization or no perceiving of sound greater in one ear than the other, no perceiving of sound greater. So this is called as normal, okay. You can see here the tuning fork is struck equidistant from the both ear, and here you can see it has gone the same way into the both ears. Now moving forward, suppose, okay, just forget the Rinne test now. Suppose you are having some problem with the conductive. Here you can see, okay, this means that your ear is blocked. Here you can see that your ear is blocked, okay. When your ear is blocked, okay, so the air conduction cannot pass easily and the bone conduction can pass easily, okay. So what will happen is the bone conduction will be greater than the air conduction, Why? Because air conduction pathway is blocked. Okay, so what will happen on Rinne test or Rinne test? You will have negative Rinne test on the right ear. Negative means bone conduction more than, okay, and there will be positive Rinne test on the left side. Why? Because left side has not any problem or doesn't have any conductive loss or any conductive deafness. So what will happen? So the Rinne test is done. Okay, on the Rinne test you see that right ear is having conductive deafness, but the left ear is normal. Is normal. Okay, normal means positive. Positive Rinne test. Okay, this was Rinne test. Now let's see about the Weber test. How Weber will give you result. When you struck the tuning fork on the vertex of the person, so the now what will happen? Both the sound, the vibratory waves will go on the both side. Okay. Now what will happen is this side the waves will come. Okay, because the air conduction is blocked. Because the air conduction is blocked. So what will happen? You must have heard the phenomenon where a blind patient can hear very good. Okay, because he cannot see, so he can hear very good. So same phenomena occurs in the in this patient. If a patient is having conductive hearing loss, conductive deafness in one ear, okay, suppose in right ear, what will happen? That his cochlea will be overstimulated. His cochlea will be overstimulated to the sound, overstimulated to the sound. Which sound? Which is perceived through the bone, which is perceived to the bone, which is perceived to the bone. Okay. Example I'm giving that suppose a blind person is very good with the sound, hearing sound because he cannot see. So here the same occurs because the patient is unable to hear properly through the air conduction. His bone conduction becomes very oversensitive. His bone conduction becomes oversensitive. Now the patient will tell you on Weber test the same, on whose Rinne test was conductive deafness on the right ear. The patient, when you do the Weber test, the patient will tell you that he perceived the sound on the right side. So there will be increased perceive of sound on the right side, right ear. So it means that there will be lateralization. The patient will tell you that I hear loud on the right ear than the left ear. Why? Because there is lateralization towards the right ear. And why did that lateralization occur? Because he cannot hear the air conduction. So his bone conduction is oversensitive, became oversensitive now. And on the normal ear, he will perceive the sound less prominent. Okay, so there will be lateralization to the right ear. Okay, so this is the end result. Conductive deafness on the so here the key point is whenever there is conductive hearing loss on one ear, so there will be lateralization to the same side, lateralization to the same side in Weber test, on Weber test. Suppose the conductive hearing deafness is on right ear, so there will be lateralization towards the right ear because he cannot hear through ear conduction. Same occurs. So suppose there is conductive hearing loss on the left ear, so there will be lateralization to the left ear. It means that he will perceive the sound greater on the left ear. Okay, there is abnormality, but still he will be able to hear the sound more on the abnormal ear, which is conductive hearing loss. Now, one more thing. Okay, here you can see. Okay, here you can see that he is having the left conductive hearing loss in the left ear. Rather, there is no conductive hearing loss. Okay, you can see there is no conductive hearing loss because conductive loss is shown through the color because the ear is blocked. Now what will happen? Okay, this is the last point. There were 2 points, neutralization and conductive loss. The last point I want to clear about the Weber test is Weber test had two meanings. Okay, 2 meanings. One I already cleared. Okay, the second one is, suppose there are 2 ears. Okay, one is normal. Suppose your right is normal and your left is having sensory neural deafness. I told you that Weber is used for what? I told you that Weber is used for detecting sensory neural hearing loss. Detecting sensory neural hearing loss and confirming what? Confirming the conductive hair deafness. Okay, conductive deafness. Whenever a patient is diagnosed as conductive hearing loss in 1 year, so you will perform this Weber test to confirm the conductive deafness. Okay, in the same conductive hearing loss ear, you will perceive the sound greater. Okay, now the second one is that whenever you want to diagnose a patient with sensory neural hearing loss, you have to perform the Weber test. Okay, now let's perform the Weber test on the patient who are having sensory neural deafness. Now this is easy. Okay, so suppose your left ear is having sensory neural deafness and your right ear is normal. Okay, so what will happen? You will struck the tuning fork on the vertex of the person equidistant from both ears. So both vibratory sensation will go to the both ears. Okay, but what will happen? One ear must be having sensory neural deafness. Okay, and the other, suppose this is having sensory neural deafness. Okay, and this is having this is normal. Okay, so wherever there is less sound perceived, that will be sensory neural hearing loss. Okay, whenever you see increased intensity of sound, you will say that this ear is normal. Here you can see that whenever you are having left ear which is having sensory neural hearing loss. Okay, so your sound waves will not come. Suppose this is sensory neural hearing loss. Okay, so these are the vibration. So the vibration here are coming through the bone. Okay, but it will not be perceived by cochlea, vestibular system and cochlear nerve more accurately and more precisely than the normal ear. Okay, so what will happen on the sensory neural hearing loss? You will perceive less sound. Okay, and there will be high sound in the normal ear. There will be high sound in the normal ear. Why? Because the vibration will come and it will be perceived normal through the cochlea, semicircular canals and vestibulocochlear nerve. Okay, so you will hear loud on the normal ear, but you will hear less on the ear which is sensory neural, which is suffering from sensory neural hearing loss. Okay, so where will be the lateralization? So lateralization will be towards the normal ear. I will repeat that lateralization means perceiving the sound is greater on that side. So the sound will be greater on normal side than the sound is perceived on the sensory neural hearing loss. If anyone has any question, he can ask. Okay, now we will read the text.
Yes, can I ask a question?
Yes, sure.
Meaning, you mean after the explanation, if I understood well,
Yes.
meaning if you do a Weber, if you do the Rinne test, right, and there's conductive hearing loss, you do the Weber test to confirm it, right?
Exactly.
Now, okay, for example, if you do the Weber test and there's increase in, if the bone conduction is greater than the air conduction.
Okay, so the bone conduction is greater than air conduction. Yeah. In which ear?
Yes, you do in the right ear.
In the right ear. Very good. Very good.
Yes.
So this is the Rinne test. Yes, yes, proceed.
Yes,
Then,
now you do the Weber test. If
yes,
you hear more in the, because it's the right
yes,
ear
yes,
that is affected, right?
yeah,
Meaning you will hear more, it will
yeah,
lateralize to the same
yes,
side, right?
yes. So you will hear more on the right side because I just wanted to confirm it. Okay, very good.
So now, if now you have a sensory neural problem.
Yeah. So
If
now you
for
are having
meaning,
sensory neural hearing. 1 second. So sensory neural
yeah, sorry.
deafness is in which ear?
For example, okay, I want to take this example. Maybe they did the Rinne test is normal, meaning
Okay,
there's no bone
very
cord,
good. So the
meaning
Rinne,
there's no problem,
yeah, the Rinne
right?
is normal. Yes, very good. Okay, now. Okay, so then, sorry.
Okay, after
Yeah.
the nan did, and now they said that the
Yes, now we
Weber
will do the
test
Weber
now.
to exclude any sensory neural hearing loss because the Rinne is normal, which means that there is no conductive hearing loss. No conductive hearing loss. Now we have to exclude the sensory neural hearing loss, which we do with Weber test. Okay, now proceed. Yeah.
Yes. If now they said that, okay, the Weber, now they did the Weber test and, sorry, yes, they did the Weber test and the right is more than in the left.
Very good. So the right is more than the left. This means that, okay, right is more. So there is lateralization. Yeah, there is lateralization on the right and there is no lateralization on the left, which means that your left is having sensory neural deafness because you cannot hear, yeah, you cannot hear properly on the left ear, but you can hear very much or loud on the right ear. Okay, now if this was, if the Rinne test was conductive, which shows if the Rinne test showed conductive deafness in the right ear, okay, now we will say that we have confirmed the right ear which is suffering from conductive hearing loss. But now, as we already did the Rinne test, which was normal and there was no conductive deafness, okay, so then we will do the Weber test to exclude any sensory neural hearing loss. So how we will know? We will come to know that if the right is having lateralization, okay, if the right is having lateralization, so it means that the one which is perceiving the high sound or loud sound is normal. Then the left one, why? Because the left is having sensory neural deafness and we cannot hear properly on the left ear. Okay, so the cochlea, maybe the semicircular canals or vestibular cochlear nerve has some problem. I hope you understood. And now we will go through the.
Yeah, thank you so much.
Welcome. So now we will go through the test. Okay, this is by far the most important image I have seen. Okay, so this will exclude all your problem. Okay, now, so if okay, so if anybody didn't understand, he can tell me. Okay, just let me. Just a second. Let me remove all this. Okay, so these are not. So now this test you have to do. Okay. Just try by not looking at the context, okay, and then tell me the answer. Okay. Okay. Now let's start. Okay. Okay. So tell me, if the Rinne test both air conduction is more than bone conduction. Now, if there is, okay, so we did Rinne test, okay, in both ear we see that air conduction is greater than bone conduction. What this did do this mean? Tell me quickly.
Normal.
This is normal. Very good. Why? Because you can hear through the air conduction properly. Okay, very good. Now moving forward, if now we will do Weber test. Okay, now we will do Weber test. Why we are doing Weber test? to exclude any sensory neural deafness. So if the Weber lateralizes to the left, if Weber lateralizes to the left, it means if we on the left side you hear proper, okay, or loud. On the right side, okay, on the right side you don't hear properly, okay, decreased sound. So what does it mean? There is a sensory neural deafness in the right ear.
Right.
Very good. So here you can see that if the Weber lateralizes to the left, there will be sensory neural hearing loss in the left ear, in the right ear, sorry. So if we again do the Weber test, okay, and the Weber lateralizes to the right side. So the Weber lateralizes to the right side. It means that on the right side, you can hear properly, okay, loud sound, and on the left side, you cannot hear, okay, or decreased sound. It means that you are having sensory neural hearing loss in the left ear. Okay, why? Because you can hear properly to the right ear. Okay, now let's move further. There is no space down below. Okay, now let's move further. Rinne left, okay, BC is more than AC. Now, when we do Rinne test, okay, we hear on the left side, yeah, on the left ear. So this is left ear and this is right ear, okay. On the left ear, BC is greater than AC, and in the right ear, AC is greater than BC. This means that right ear is normal, okay. Why? Because air conduction is greater than bone. Now on the left side, you can see that the bone conduction is greater than the AC, which is abnormal. Bone should not be greater. This means that your air is clogged up by something. There is some obstruction. That's why your air cannot go properly, and rather your bone can conduct properly. Now, it means that you are having some conductive hearing loss in your left ear. Okay. Now, what we will do is we will do Weber test to confirm it. On the Weber test, I can tell you that because it is left ear, okay, so the left ear, there will be left ear, there will be lateralization. Why? Because left ear will perceive the sound very loud. Why? Because I told you it becomes oversensitive. The cochlea becomes oversensitive. Despite the fact that there is conductive hearing loss in this same ear, in the left ear, but you will perceive sound louder than the normal ear. Why? Because of the conductive hearing loss, there is oversensitization of the cochlea, vestibular nerve, and all the semicircular canals. Okay, that's why. So Weber will lateralize toward the defective ear. Okay, so now we have confirmed that left ear is having conductive hearing loss. Okay. Now, suppose, okay, now let's move further. So here you can see BC is more than Weber lateralizes to the left conductive hearing deafness. Yes, look, conductive deafness was in the left ear. Okay, we confirmed it. Now, if Weber lateralizes to the right, then what will happen? If Weber does not lateralize to the left, rather it lateralizes to the right, then what will happen? This is tricky. If the Weber, in spite of the fact that there is confirmed conductive hearing loss, but the Weber still goes towards the right side. Okay, it means that your there is confirmed your left ear is having conductive hearing loss.